Hello. For this exercise, we are going to work on a little bit of hip flexor strength, okay? So sometimes, hip flexors get a really bad rap because they're generally always super tight because we're always sitting and shortening this muscle. So, you know what we say, a tight muscle is a weak muscle. So, new research shows that if we strengthen it, ideally, it doesn't get as intense and as doesn't cause as much pain per patient. So, I'm going to have you take a weight. This here is a 10-pound weight. This is what I have currently in the office. Maybe you need a 5-pound weight, or maybe you don't really need any weight at all, maybe just a little bit of resistance. And then from there, you can use a resistance band. But for the purpose of this exercise, I'm going to place this 10-pound weight on my leg, and I'm going to lift it up from sitting on the table. Maybe you're sitting on a kitchen table, chair, maybe you're sitting on a stair, maybe you're sitting on a bed, maybe you're at the gym, and you're just warming up your hip flexors this way. And then, the harder that it is, the more that you put the weight out to your knee. Okay, so you're just going to sit here. And this is not a low back exercise. If you feel your low back kicking on when doing this, that is kind of how you know that anytime that you're trying to walk, move, bend down, when that hip flexor should ideally be stabilizing, your low back is doing the job for it, which might be why the hip flexor is a little bit weak, also showing why you might have some hip flexor pain. Okay, so I'm going to switch sides. I'm going to put that weight on the opposite side. I really want to make sure that your core is nice and stable, that lower ab is really working and staying nice and tight. That abdominal brace has fully turned on by getting that breath go into the sides, especially where your rib cage is. And from there, you're going to lift that weight straight up. Maybe you're doing 10 reps each side, just a little bit of something to work on that hip flexor strength, okay? Please let me know if you have any questions at all.